Okay. Good
Good.
morning. And sorry, Judy. I'll quickly just introduce. So welcome to today's webinar on building mental health resilience. So my name's Jess. I'm Health Promotion Manager at Arthritis Queensland and New South Wales. And we're really excited to have Judy with us today presenting this webinar. So just quickly before I introduce Judy, just a reminder that the information provided in our webinar series is of general information and advice, and we always recommend consulting with your doctor or healthcare provider to obtain individual medical or treatment advice. So I'm very excited to introduce Judy today. So Judy is Australia's expert in psychoneuroimmunology-based relaxation therapy and an international speaker. She has a PhD from University of Sydney and a diploma of adult education. With up-to-date knowledge, passion, and humour, Judy teaches how relaxation therapy enhances mental health and physical well-being. Judy emphasises the importance of personal relaxation practice for self-care for anxiety, pain, trauma, depression, sleep disorders, and chronic inflammatory conditions. She's determined to increase relaxation therapies in 21st century healthcare. So hand over to you, Judy. Please take it away.
Wonderful, Jess. Thank you very much. I'm delighted to present to you. I know that you have the choice. If you are happy to turn your cameras on, it makes it more personal for me. But obviously that is up to you. If you're happy to, please turn your cameras on. So I'm going to begin by asking you a question, and we'll come to the answer later. But what I'd like you to do is either write into the chat room or unmute and tell me what is the first thing that you would do if you want to squeeze through a tight space. What's the first thing that you would do to get through a narrow space? So you can write it into the chat or you can unmute and say.
Breathe in.
Breathe in, all right. So what I'm going to do, if anybody else wants to unmute and say, or type in, and we'll come back to that. Now, in the next hour, I have a lot of information for you. You will get the recording. I do like to include quite a bit of as much theory and research and evidence as possible, but we are going to do some prac, and you are going to leave with an introduction to the skill of taking slow breaths to reduce anxiety or pain or anything like that, chronic conditions. I'm not going to spend a lot of time on this slide. It's something that you can look at later. Just some interesting little fun facts about respiration, because I'm going to be talking about slow breathing for pain relief. Well, it's a couple of important things. We actually, at a cellular level, get more energy from oxygen than we do from nutrition or from water. And that is evidenced by the fact that we can survive for up to 40 days on average with water, but without food. 40 days without food. 4 days without water. 4 minutes, up to 4 minutes without oxygen. Oxygen is the most important for life. It's primary, whereas water is secondary, food is tertiary. What's also really important, I'm going to highlight this line here, is that we inhale where comfortable and possible in and out through the nose. And it's more important to inhale through the nose. And that's because the hair and the mucus warms, filters, and moistens the air, because dry, cold, unfiltered air is not good for our lungs. So where possible, inhaling and exhaling through the nose. I also want you to think of the lungs as three-dimensional as they are. We're going to be thinking of the lungs. They go to the front of the body, the side of the body, the back of the body. Three-dimensional top and bottom. And we take something like close to 700 million breaths in an average 80-year life. So it's critically important. Okay, there is by the end of the hour, I want you to have the confidence to know that this is evidence-based. Taking slow breaths in and out through the nose has a lot of research to demonstrate its efficacy and its benefits. And there's a strong body of research of looking at slow breaths, different breathing techniques with all these different and more conditions. Okay. Some arthritis is autoimmune related, many of it is stress related, certainly pain related. So there's plenty of research. And I'm not going to go again into too much detail, but this is an example. And when you get the recording, this is a direct link. So if you're interested in reading or at least having a brief look at some of the research, you can click onto this and it will take you to the journal article that looks how the patterns, the way in which we breathe. Are you a shallow breather? Do you take slow, deep breaths? The pattern and the rhythm are influenced by our emotions, and our emotions are influenced by the rhythm and pattern of our breathing. Now, that has been scientifically observed, and a lot of the research looks now at what's called connectivity in the brain. So the firing of different neurons across different areas of the brain. So I won't go into any more detail, but I find it fascinating. It's the research that keeps me really stimulated, intellectually stimulated, because the research is becoming more and more sophisticated. The brain imaging technology is improving, and we can see what happens when we're relaxed compared to when we're stressed. What happens in the brain when we experience pain and then when we do some relaxation, like taking slow breaths. All right. This is another study, and Ravinder Jareth has done a lot of work in relaxation. He's an American physician. I'll just give you this is the autonomic nervous system, okay, which regulates stress and relaxation. And we can modulate our autonomic nervous system by taking what's called diaphragmatic breaths, deep breaths, slow breaths. The main reason for this slide is that this researcher and doctor emphasizes that deep, slow breathing should be a first line treatment, a primary intervention for things like anxiety, depression, pain, mood disorders. Okay, not just, oh, nothing else has worked, let's try this. He's advocating that slow breathing should be treated, should be a treatment that's used first and foremost. Doesn't mean to say it can be used in conjunction with medication, in conjunction with psychological interventions, but it certainly shouldn't be left out. So he's really strongly advocating the benefits of slow breathing.
Judy, sorry to jump in.
Please do.
How come doctors don't advocate that then? Because all they want to do is throw tablets at you, and they don't mention anything about your breathing, or they just I've got depression and anxiety, but my doctor has not mentioned anything about my breathing, and it doesn't even come up. And like you, I love doing research, and I've been looking at, what sets off pain and how to turn those signals off. And I'm not really.
I'll answer your question, Gail. Doctors, it's agonizingly slow. I've been doing this for over 25 years. There is now an exponential growth in the integration, like integrative medicine, lifestyle medicine, of including these sort of things, nutrition, stress management, which I like to call relaxation therapy, the importance of socialization. The old school doctors who ignore all of this, can I say, are not going to last much longer. I do teach doctors, psychiatrists, psychologists, social workers, dentists are more and more interested because they deal with anxious patients all the time. I have a course at Sydney Uni. It's happening, but agonizingly slowly. So you need to educate your doctor, is what I can say. Flick him these notes when you're good and ready, or her. All right.
Can you move to Queensland?
I work online as well. The last slide of this handout are my contact details, so you can have a look at that. Okay, so I want to talk about it's the vagal nerve or the vagus nerve. We won't get hung up about different names. It's the main nerve that stimulates the parasympathetic nervous system, which is what calms us. Okay, and it in turn is affected by slow breathing. So I'm giving you a little bit of the physiological processes involved as to why taking slow breaths does work, does make a difference. And one of the mechanisms, the pathways through the body, is via the vagal nerve. It is the main nerve of the system that relaxes us. It's one of the 10 cranial nerves, so it comes up to, it's the lowest one, it comes up to the top of the neck. But what's amazing about this nerve is that it goes to our major organs, including our heart. And this next slide, what I want to show you, this is the diaphragm. So when people talk about diaphragmatic breathing, this is the main muscle of respiration, which most people don't use. Okay, we breathe from up here instead of deeply down here. What happens, the yellow is the vagus nerve, and it goes through the diaphragm. It passes through. So here's the diaphragm, and the nerve fibers, different fibers of the nerve, pass through, just like the esophagus does. Okay. When we use the diaphragm, it stimulates the vagus nerve, which then stimulates our calm, relaxed parasympathetic nervous system. Okay.
Is it possible, Judy, to manually massage the vagal nerve, like by rubbing your chest?
No, but you can massage the diaphragm. It's difficult, but it's a great question. Taking slow breaths works the diaphragm, which massages all your organs in the abdominal cavity, your spleen, colon, everything else, abdomen. And it will massage, again, it's semantics. It activates the vagus nerve. It gets it doing what it should, and I'm going to talk about that right now. There is a lot of research, and I have presented with one of the main researchers, a man called Professor Gidron, Gidron, and I think this is the link to his article. There's research, time and time again, a good, strong body of research that demonstrates that if the vagus nerve isn't activated enough, it leads to disease. And that is a cause and effect. Now, we couldn't say cause and effect 5-8 years ago. But the research shows that if you don't take slow breaths, if you don't use the diaphragm, if the vagus nerve is not activated adequately, regularly, it increases the risk of chronic disease. And conversely, if you activate the diaphragm and the vagus nerve, it will reduce the risk of chronic diseases. And all of this can be done by taking slow breaths. Okay, so without going into too much of the scientific detail, but so that you know that this is well researched and understood and accepted, when we stimulate the vagus nerve by using the diaphragm, taking slow breaths, a whole lot of beautiful calming neurotransmitters are released. Anti-inflammatory chemical messengers from the immune system are released. And there's a better check on tumor markers or any, what's the word? Mutated cell before it gets to be cancerous. Okay, so what we know is that when the vagus nerve is in good condition and adequately stimulated, it reduces the risk of disease. That's cause and effect, not just that it's associated with or correlated with, but bang, bang. A lack of vagal nerve activity increases the risk of chronic disease. So here we have deep breathing or diaphragmatic breathing stimulates the parasympathetic nervous system, what calms us, via the vagal nerve. Okay, this is just more detail about how it relates to, say, rheumatoid arthritis. There is talk in amongst the scientific arena that perhaps, so when you said massage the vagal nerve, they're looking at an electrical nerve, vagal nerve stimulation to treat rheumatoid arthritis, because we know that a disruption of the autonomic nervous system is very much linked probably to most arthritis and most types of arthritis. Cardiovascular disease, CVD, cardiovascular disease, and all the mood disorders, the different types of anxiety and depression are common in amongst people who have, as you know, arthritis. And all of this is linked to the autonomic nervous system. The autonomic nervous system is split into two: your parasympathetic, which is calming, and your sympathetic, which is arousal. All right. So I don't want to go on too much about the science. I want to get on to the prac. There's some more research that you can have a look at. The links are there, so you control link and you can get directly onto the research article. All right. So let's have a look at some of the actually learning how to take slow breaths. And what we do know is that when we regularly take slow breaths, and the key is regularly, we know from good research, it's evidence-based, the benefits are evidence-based. It gives you greater control over your health and well-being. And in psychological terms, having control over your health, having control over anything in our lives is better for mental health. Okay, so I'm here based in Sydney. If I'm stuck in Sydney traffic and I can't move forward, I can't move back, can't turn left or right, it's beyond my control and it's exasperating. Okay, so when you have greater control, like having the choice and the control to take slow breaths, that alone by itself is better for your mental health. We also know that taking slow breaths, well, it's certainly non-pharmacological and non-invasive. There is a whole area of research that shows that taking slow breaths regularly, and I'll talk about how regularly, reduces the burden of the healthcare dollar. There is strong evidence, say in cardiac surgery, that people matched cohorts, control and intervention, slow breathing or relaxation, say in cardiac surgery, the intervention group leave hospital earlier. Their length of stay, LOS, is reduced, and that saves thousands of dollars per day per person. It's not only cheap and free to do once you're taught, it saves our economy. And that's studied by, you know, health economists. It's once you've learnt it, it's free and it's portable. You can be in a meeting, you can be at a family gathering, you can be on the bus and take slow breaths. And people may not know. Okay. So this is a nice position to be in when you're practicing at home. But you can take slow breaths standing, you can take slow breaths sitting. So we'll do seated now. It's really nice to bend the knees if you want, rather than bend the knees like this, put a nice couple of pillows under your knees. It supports your lower back and it allows, it softens your abdominal musculature so you can breathe deeper. Now, when I teach, I have my trusty balloon. This is a very sophisticated teaching aid. And I want you to think of your torso as a balloon. And here's the human torso. The torso goes from the collarbone, the clavicle, down to your pubic bone and all the way around. It does not involve the shoulders. So we're not breathing like this. Okay. And this is our balloon. Now, what happens to a balloon when it fills with air? It gets bigger. And when a balloon is emptied of air, it gets smaller. Thinking of your torso three-dimensionally like a balloon, as we inhale, we're going to get bigger. And as we exhale, we're going to get smaller. All right, now if it helps, I'm going to take you through this in a minute. So just wait for me and we'll do it together. If you want, you can place one hand on your chest and one hand on your tummy, and that gets you in touch with whether you are expanding or not. And remember that taking slow breaths is a skill. It's like riding a bike, it's like driving a car, it's like putting in a catheter for nurses, or any skill requires regular practice to gain proficiency. And if I had $1 for every time I told people to practice regularly, there'd be a nice pile of dollars. All right, we're going to do the prac in a minute. I want to go through what you need to do first. So other than right now, when I'm going to take you through it, what I suggest when you get the notes, print this page out. Make sure you're not interrupted. Well, I do advocate hydrating. Have a glass of water in case you need to cough, but really good to hydrate. And I love that Jess is nodding because she's a dietitian and she knows. Don't be cold. So whether it's for security, even in the height of summer, you might want to like a sarong or a sheet, something light. Or limit all interruptions. Have a pillow under your head. Now the pillow should be the right height. So if it's too thick, your head will be like that. If it's too thin, your head will be back. So we want to keep the neck in line with the rest of the spine. If you're seated and in a chair, make sure your feet are on the floor. I'm a great believer in lumbar rolls. So it's support. So instead of slouching, you can sit. It's easy to sit upright, and you can roll a towel. You don't have to spend any money. So I really value lumbar rolls. Just a sausage pillow or a roll of towel in the small of your back. So that helps us keep our spine as straight as possible. Always go at your own pace. So I might be saying breathe in and you're still breathing out. That's fine. You go at your own pace, and comfort is all important. And smooth. So I don't want anything forced, like it's smooth and it's slow and it's soft. And you have homework. So over the next few weeks or months, now, if you're only comfortable taking one slow breath, start with one slow breath. My motto is one slow breath is better than none. 5 is better than 4. But you have to be comfortable. And I advocate that you take 5, at least, you're welcome to take more, but at least 5 slow breaths, preferably twice a day. If you do it once a day, that's fine. All right, and we'll talk about when in a minute. All right, so I'm now going to take you. Are there any questions? There's lots of comments in the chat. Let's have a look at the questions. And what I'm going to get you to do is, Jess will tell me if there's any questions. Bring your buttocks back in the chair. Lower your shoulders. So we're not going to be breathing with our shoulders. I actually have a footrest so that my feet are really comfortable. You can put a book or a bag or something. I'm going to talk you through taking a few slow breaths. You go at your own pace. I will encourage you to close your eyes, but you can keep them open. So you have control over what you do. If you don't like the exercise, you can stop it. You can come back to it. So what I'll get you to do is sitting back. If you have glasses, you're more than welcome to take your glasses off. There's an immediate relaxation of the muscles on the bridge of the nose and temporalis. And I'll start to talk you through it. You make sure that you're comfortable and going at your own pace. To begin with, bear in mind that idea of your torso being a balloon. And we're going to start simply by bringing your awareness to your body on the chair. So become aware of the weight of your body and the buttocks on the chair. Notice the point of contact and at the back of the chair and with your feet. And it is perfectly normal for thoughts to be darting around. Become a little detached from your thoughts, maybe allow them to slip or melt away. And always bring yourself back to the awareness of the weight of your body on the chair. Allow other thoughts to slip away. In your own time, from a bird's eye view with your eyes closed, if you're comfortable, see yourself sitting on the chair. Notice your body on the chair, the weight, the position. And without changing anything, notice your breath. Stay the same. You're aware of your breath. Where does it start? Where does it go? And in your own time, allowing other thoughts to slip away. Think of your torso as a balloon. And as you breathe slowly in, make your torso bigger. Exhale, empty, sink down. In your own time, always comfortable, Slowly breathe in and expand. Exhale, sink down. Allow thoughts to slip away and come back to expand as you inhale and sink down. Exhale. Always comfortably at your own pace. And to inhale, expand. Exhale. And now in your own time, take 3 slow breaths. In your own time. Slowly. And making sure you're as comfortable as possible. When you're ready, after one more slow breath, keep your eyes closed and allow your breath to fall comfortably, naturally, effortlessly. And gently bring your awareness to how you feel now. Gently wiggling your toes. Wiggling your toes. Bring your awareness to you in the room. Wiggling your fingers. With your eyes closed, rub your hands together. Generate some heat in your hands. And then with your eyes closed, place your hands over your eyes. Aware of how you feel now, gently opening your eyes behind your hands and take your time to come back. And without looking at the clock, just have a guess at how long that took. Unmute and tell me how long you thought it was, and then we'll discuss that experience.
5 minutes?
Yeah, it was about 6 or 7, or from woe to go. All right. Now, I will answer Gail in the chat. Not being able to feel either your chest or your tummy move is simply because you're not breathing and you're not accustomed to it. So that's what I meant by it's a skill. Nobody can hop out onto a freeway the first time they drive. You will find that you will become slower, deeper, more comfortable, more movement, more expansion with the inhalation, more sinking down with the exhalation as you practice. It is not unusual for some people to feel more anxious, more tired, more panicky to begin with. And my recommendation is practice with one breath as often as you're comfortable. All right. So Gail, if that answers, let me know or put in another question. Excuse me.
Yeah, that answers it. Thanks, Judy.
Good, good. All right. Okay. Let's keep going on, and I am going to do another exercise in the same again, so that you have two practices before you go and do it regularly for yourselves. Okay. I mean, my whole business is about encouraging people to learn to relax and teaching medical and health professionals how to tell their patients to relax. We need to understand what is stress, and there's a misconception about stress. Stress is life. Without stress, there would be no life, because the true definition of stress is a demand placed upon us that requires us to adapt and change. Okay, and I'll give you examples of that. The breakfast you had this morning is a demand placed upon your digestive system to adapt and change. Get those gastric juices released. Get the peristalsis, the movement of the colon, to move the food along. Absorb the nutrients, eliminate the waste. The food is a demand placed upon our digestive system to adapt and change. Listening to a presentation like this is a demand on your concentration, on your analytical cognition, thought processes, memory, interest. Okay? Don't think about what you've got to do this afternoon. Don't think about what's for dinner tonight. The content, my presentation is a demand placed upon your cognitive processes, your thinking. Everything going from bright sunshine into a dimmer room is a demand placed upon your rods and cones and pupils in your optical system. Okay. Everything about life is a demand, is a stressor. When people say, I'm so stressed, what they mean is they're distressed. And distress arises from a reduction in the ability to cope with the demands placed upon us. Okay, and that's the crux of it. Now, coping is a spectrum from being slightly annoyed by this extra demand that I've got to do something for a relative that I really don't want to do. I'm a little bit annoyed, right through to major depressive disorder, can't get the doona off my head. So stress is a normal part of life. When we say I'm stressed, we mean I'm distressed. I'm not coping as well. In fact, I'm coping really badly. I'm not coping at all. And that's an important distinction. And I teach doctors and medicos and allied health professionals this very important difference. Eustress, not enough people know about eustress, which is good stress, stress that fires us up, motivates us. I've got a presentation with Arthritis Australia, Queensland, New South Wales. It's what allows us to reach our potential, to get satisfaction and be productive and contribute. So that's eustress. And if you think about it, EU is a Greek prefix and it means good. A euphemism, you put a better slant on something than it actually is. Euphoria, a good feeling. And I say this because I want to highlight, euthanasia means good death. That's what it means. Okay. So let's keep going. How much time? I'm actually going to skip this slide. You'll get it. You can read it. It's straightforward. And same with this one. Have a read of that. Chronic stress affects every part of our being, our mind, our body, our being. Okay, so what I'm going to do is now take you through another, exactly the same. We're going to do it again, taking slow breaths. So what I'll ask you to do once again, if you're happy to take your glasses off, bring your buttocks back in the chair, shoulders down, feet on the ground or on a book or whatever. I have a quick look.
Yeah, just a couple of questions, Judy,
Yes.
before we continue. Gail had a really good question. Can eustress cause stress?
Oh my. Oh, look, it could. Yes, yes, it can. And it's unique to each individual. So let's say, because our experiences, our perceptions change everything about us. So if in the past, and this is one example to answer that question, you were having a good time and then something happened, then the next time you feel that the same way something negative happened, the next time you feel that good feeling, the same as the last time, you may associate it with then something bad is going to happen. Does that make sense?
Yes.
Yeah. So, we are just so fickle and foible, anything can happen anytime.
Yeah.
But having said that, the more we generate a good feeling for ourselves by taking 5 slow breaths twice a day, the more we can put ourselves into that good feeling.
Yeah.
That eustress. Box breathing, I'm not going to talk about. We just don't have the time. What I've done, what I'm teaching you, and it's very useful. I don't teach it, especially in 1 hour. I'm already pushed for time. There are a lot of different ways to regulate your breathing, and that's one of the things that's so amazing. It is autonomic. We don't think about having to breathe in and breathe out 24 hours a day, and yet we can control it. What I teach by what I've just done and what we're going to do again is the most basic biomechanical, get bigger as you breathe in, smaller as you breathe out. I listened to a lecture by someone who does very similar work to me, and he called it stupidly simple. I call it KISS, which is much nicer. Keep it simple, simple, keep it simple, simple. KISS, keep it simple, simple, simple. Get bigger as you breathe in, smaller as you breathe out. Then if you want to look at pranayama, yogic breathing, box breathing, there's a lot more. I hope that answers that. I can't read all of that. Okay, so let's go through the exercise once more, and then we can have a quick answers Q&A. Sitting back in your chair, buttocks are back, feet planted on book or floor, shoulders are down. Go at your own pace, open your eyes. All right. With your eyes closed, bring your attention to your body on the chair, the distribution of weight. Notice your body, the points of contact on the chair, and allow those other breaths, those other thoughts to drift away. Come back to you. And notice your breathing without changing anything. Notice your breath. Where does it start? Where does it go? And now, in your own time, if you want to put your one hand on your chest, one hand on your tummy, as you inhale, expand. As you exhale, slowly sink down. Inhale, expand. Exhale, slow. Take 5 slow breaths in your own time. aware of your breath. And after 5 smooth, slow breaths, allow your breath to fall effortlessly, slowly. Bring your breath back to natural, no effort. And become aware of how you feel now. Notice how you feel physically. Feel on the inside, mentally, emotionally. And very gently wiggling your toes, bringing your awareness back to yourself in the room. If you can, keep your eyes closed. Grab your hands together, get some warmth in those hands. Place them over your closed eyes. And take your time coming back. And that was about 5 minutes. So the point of taking you through it, we've got 9 minutes. If any, I'm so relaxed, I want to go to sleep. Okay, which brings me to what somebody else had in the chat room. If you have trouble sleeping, if you wake up at 3 a.m. and can't get back to sleep, lie with a pillow under your knees and one hand on your chest, one hand on your tummy, and take those slow breaths. And if you lose track and focus, that's okay. Come back and take another breath, and each breath at a time. Did anybody feel any difference between the second exercise and the first? And you don't need to write it, you can unmute and say it's quicker, easier. Did anybody find it difficult? You could feel some movement in your tummy. Great. So if you get that kind of improvement after 2 exercises, imagine how you'll be next week, next month, next year. Because every night when you hop into bed, you're going to do this exercise. And then pick another time in the course of the day, whether it's the shower, if you shower in the morning, or waiting for the kettle to boil, or you pick a time that you do regularly every morning, and then when you when you hop into bed at night. All right. So one difference was that, Gail, you could feel some movement in your tummy, which is fantastic. Always think of your torso as that balloon, getting bigger as you breathe in, smaller as you exhale. Okay, so I'm going to go back to...
I think there's a comment, but it may not have come through to everyone, but Heather had mentioned she almost fell asleep. So I guess that's great. It was very relaxing for her.
That's the whole idea. Okay, would you do these breathing exercises when in pain? Yes. There is research that shows that it decreases. Now, the research does vary. Some says it decreases the perception of pain. So your pain may still be there. And this is what I've found clinically. I have had people say, I did not feel any pain during that exercise. So that's the perception and awareness of pain. Your nerve endings might still be firing, but you can decrease pain with relaxation techniques like diaphragmatic breathing, like what I'm showing you. This is, and very quickly, I'm going to show you. So this is the diaphragm. It's an amazing muscle. When we inhale, so this is a diagram, when we start to inhale, So this diaphragm is relaxed. When we inhale, the diaphragm, it doesn't flatten completely, but it moves down and flattens a bit. And that enables the lungs to get bigger. There's our balloon getting bigger. As we exhale, the diaphragm relaxes and pushes the carbon dioxide metabolic waste out and makes the lungs smaller. All right, so that you'll get these notes. This is really good visual aid. Okay, so who said breathe in when you wanted to get through a small area? And what would you do now?
I'd still breathe in, but I'd relax.
No, Gail, you're going to breathe out and get smaller, like a balloon. And the reason I asked that question, and I have asked thousands of people that question, and I kid you not, 7 people have answered it correctly, have said breathe out. It goes to show that most of us, because we're stressed and distressed, and we've lost touch with our relaxed self, and we're told to suck it in all the time, we've forgotten that you get bigger when you breathe in like a balloon and smaller when you breathe out. Thousands and thousands of people have said breathe in, and they're wrong. All right, we have 5 minutes left.
So is that when we're in a small space, we tend to breathe in to make ourselves smaller so we can squeeze through it? Now I get you.
Yes. Sorry, maybe I didn't explain clearly enough. So people will say, yes, I'll breathe in because they're imagining that they're getting smaller. Whereas we should be breathing in, getting bigger. Okay, so there I've all right. So this is your homework. When you hop into bed at night, lie with your spine as straight as you comfortably can, knees supported, head supported, and take, whether it's 1 slow breath, 10 slow breaths, whatever is comfortable for you. And you will get my details. You are more than welcome to email me with questions or more information. I'm going to be talking to Jess about possibly doing some more of this because 1 hour is just too little.
Oh, yes, please do some more. I love it. And can I come live with you for a week so I can get married?
Yeah, thank you for the offer. All right, if there are any questions in the next few minutes, and if not, I can actually go back.
I think we have touched on all the questions that did come through in the chat, but I actually, Judy, I do have a question and sort of around what I guess some of the mechanisms are that help, that breathing helps with sort of, because it seems like it can be a benefit, to pain or, our mental clarity and all those sorts of areas. And I guess I've always thought, when you're sort of feeling overwhelmed or nervous and you do some deep breaths, it can really help to sort of clear your thinking. And I've always assumed, there's some sort of role of getting more oxygen to the brain. But in doing that particular breathing exercise as well, I realize there's the components of, you're redirecting your thoughts and you're sort of focusing on the now. Is there, I guess, sort of any other mechanisms
there
involved?
are many mechanisms. So when we look at relaxation, and I can teach this more if we have an opportunity more, the underlying fundamental principle, and it's whether you do diaphragmatic breathing, yoga, tai chi, mindfulness, whatever it is, when you knit for relaxation, when you go for a walk, the way it relaxes us, and this is one of the mechanisms, is focus. Okay, now you can call it awareness, being in the here and now, mindfulness, meditation. It eliminates all that chit chat. that distresses us. It puts it aside. So focus is the first and foremost mechanism by which this works. You know, when you're at work and you're concentrating on your work, you're not thinking about the disasters at home or troubles or whatever. So it's the focus. And in relaxation, we focus on positive things, on relaxing things, on one thing. We keep it simple. Somebody just, I think Leanne just wrote in inverted commas, it is simple. Yep. The evidence is becoming more and more sophisticated. The techniques have always, for thousands of years, been simple. Then, just to briefly answer you, via heart rate variability, vagus nerve, the release of different neurotransmitters, hormones, the switch from sympathetic to parasympathetic, lots of mechanisms by which it works.
Absolutely. And like you said at the start as well, for something that is so freely available, sorry, I've got a bug, something that's freely available, anyone can do it, and it's got such wide-ranging benefits. So it's crazy that we don't all grow up knowing to do this more.
Yes, no, it is crazy. So, well, I thank you. We are right on 11 o'clock. I think it's important to finish on time.
Yeah, definitely. And there isn't any more questions coming in. There's a whole lot of thanks and people jumping off, letting us know they're definitely going to practice some of those breathing sessions going forward and do their homework.
Terrific.
Thank you, Dr. Judy, but my doctor's going to hate you once I print this all out and give it to him.
That's okay. He's welcome to contact me too.
Well, thank you so much, Judy. It's been wonderful having you present today and take us through some of those guided sessions. And we definitely will be in touch and hopefully be able to run some more sessions going forward, because it's so useful. I really like the practical component of those sessions. So thank you so much.
And thank you, Jess.
Thank you, Gail. Thank you for joining us.
Take care, everyone.
Yeah, hope you all have a wonderful day. Thanks. Bye.
Bye now.
Thank you. Bye.